Hello, my name is Erica Kim. I'm currently a Master of Public Health candidate at the Yale School of Public Health. I'm presenting on behalf of my co-author, Dr. Saria Hassan from Emory-Rollins School of Public Health. And the title of our project is Understanding Challenges to Managing Non-Communicable Diseases After Natural Disasters in the Caribbean, a qualitative study. So to start, climate change is projected to result in a number of environmental effects in the Caribbean region, including increasingly severe extreme weather events. This will translate into a number of negative public health outcomes for communities across the globe. However, in this study, we focus on how this will affect non-communicable diseases in the Caribbean, which is a region of the world very prone to natural disasters. In 2017, the Caribbean experienced an especially deadly hurricane season with over 3,000 deaths. At least 1/3 of those deaths were found to be due to poorly managed non-communicable diseases. In this study, we posed two research questions. One, how do governments and organizations currently work to address the health needs of people living with non-communicable diseases in preparation for, during, and after disaster events? And number two, what are the experiences of people living with non-communicable diseases in the setting of disasters? Our objectives and methods are listed here, but I will skip these in the interest of time. The results of our project are split into two different levels, the governmental and organizational level and the individual level. At the organizational level, informants reported that there's a striking lack of integration of the needs of people living with non-communicable diseases into quote unquote traditional aspects of disaster preparedness and response. This was described to be due to multiple reasons, including traditional disaster response only focusing on immediate effects of natural disasters, such as providing emergency shelter, distributing food and water, and treating injuries sustained during the disaster event. However, things like non-communicable disease care and also mental health care are more long-term effects of disasters. And so this was reflected in one of our interviews with a member from PAHO, the Pan American Health Organization. Furthermore, our stakeholders reported that the COVID-19 pandemic has changed multiple aspects of how we manage chronic health conditions that could impact disaster preparedness and response. These include things like swiftly shifting to electronic and paperless systems and staying that way indefinitely, shifting resource focus to disproportionately at-risk populations, which includes people living with non-communicable diseases, and rewriting training and response procedures that are based on lessons from COVID-19, but will be applied to natural disasters going forward. At the individual level, our respondents communicated multiple challenges that they had encountered that are brought on by disasters. So our respondents reported that natural disaster events alter multiple aspects of their care routines in ways like losing access to their regular healthcare facilities and not being made aware of a contingency plan for where to go for their care, having their exercise regimen disrupted and having to create new regimens at home, as well as having disrupted access to healthy food at the market. Additionally, there were several similarities between the challenges encountered by people living with non-communicable diseases during a natural disaster and the recent COVID-19 pandemic. Another finding we made when speaking to people living with non-communicable diseases is that there are clear mental health implications of disasters on people living with non-communicable diseases, primarily due to being high-risk patients. Disaster events prompt people living with non-communicable disease to think in terms of needing to prepare and protect themselves during future natural disasters. So for example, some of our informants told us that they order and keep extra supplies of their medications as a way of preparing themselves for if resources were to be cut off in the event of a natural disaster. Because people living with non-communicable diseases are high risk, informants also reported feelings of worry and anxiety related to the COVID-19 pandemic, and these worries also translate into thinking about their risk status during natural disasters. Therefore, different areas of concern and worry for people living with non-communicable diseases are compounded on each other during disaster events. People living with non-communicable diseases report that to mitigate their worries, they try their best to stay healthy by keeping their regular medication schedules and maintaining other aspects of their health, like eating well and exercising. This is a summary of our major themes, and then this is a summary of our quotes. So in our discussion section, we conclude that people living with non-communicable disease suffer additional physical and mental risks during and after natural disasters. There are multiple shortfalls to disaster response that do not yet work to cater to the additional needs of people living with non-communicable diseases. Interestingly, the COVID-19 pandemic has pushed governments and organizations to rapidly reform different aspects of disaster response that address the additional needs of people living with non-communicable diseases. These reforms will carry on to be utilized in future natural disaster events. And the pandemic has also urged people living with non-communicable diseases to further contemplate their at-risk health status and take more protective measures to preserve their health during and after disaster events. These are some strengths and limitations we've identified with our study that, again, I will skip in the interest of time. And we would like to conclude with some implications for future policy here. And to close, thank you so much for taking the time to watch our presentation. We'd like to thank our project funding source, the Yale Institute of Global Health, as well as our key collaborators in the study. And lastly, we'd like to thank our project participants for their time and willingness to share their experiences with us. Thank you so much.